for delayed care as a consequence of the pandemic. Um, Delayed diagnosis of cancer and cardiovascular diseases are the types of claims we fear the most because they are the highest value claims that we deal with for non-surgeons. And as a consequence, they're the ones we're most fearful of. And there's also some concern that's based on studies that established that as many as 41% of US adults deferred, delayed, or disrupted their medical care and treatment as a consequence of the pandemic. In other words, they were either not allowed to see a doctor because of the hiatus that was imposed by the Centers for Disease Control, or they feared going into the healthcare system and getting exposed to COVID-19 as a consequence of going to a doctor or a hospital. And so we're very concerned that we'll see those claims because of the high number that was established in one particular study, and the fact that another follow-up study suggests that as many as 10,000 people are going to die from delayed diagnosis of cancer, for example, over the course of the next 10 years. We know there was a huge disruption in screening mammograms, in terms of colonoscopies, in terms of chest x-rays, all of which were designed to diagnose cancer. There were cardiovascular tests, like routine tests, like stress tests and other tests that would have been performed to diagnose cardiovascular disease. So we know there's a disruption and a delay in care that could make people sicker than they otherwise would have been had the diagnosis been made earlier. And certainly the importance of an early diagnosis in cancer in terms of overall survival rates is the best thing a patient has going for them. So we are very concerned that we will see cases falling out of that category of situations